There we go.
Hi, how are you?
Hi, how are you?
Good, good, very well. Thanks for having us.
Thank you for joining. Everyone, this is Dr. Hisham Seify from Newport Beach, California. Dr. Seify is a world-renowned plastic surgeon who also does reconstructive surgery as well, and we're very, very happy and thankful to have you with us. How are you?
Thank you very much. I'm very well. I don't know if I'm world renowned, but thank you. It's very kind of you.
Well, internationally, right? You have practiced internationally.
I do. That's true. I do.
That's
Thank you.
wonderful. Of course, we're happy to have you and today our topic is about, how the aesthetic medical community can give back during these times. I mean, we've never gone through this. Our grandparents have never gone through this. Our parents have never gone through this. I think it's funny when people say, I've never seen anything like this in my life. Actually, generations have never seen anything like this in their life. And so today we wanted to talk about how the aesthetic community can give back and what our aesthetic professionals and peers are doing at this time, and check in and how are you and how's your business going and all of that.
So these are obviously very difficult and unprecedented times, and all my respect for my good friends in the ICU and the intensive care units. They're really taking care of patients every day. I mean, just to think about that you leave your house every morning and you know you're going to take care of a COVID-19 patient who you can get infected, and whatever you do, that can happen. I think it's a great sacrifice, and a lot of my respect for that. Now, for our business model, and if you're doing 100% cosmetic surgery, then pretty much most of your work is now closed. I mean, all elective cases are canceled. Most of the office-based procedures are canceled. Practices that have some reconstruction, so we do some cancer reconstructions, that part is still going, related to the hospital rules and regulations and stuff like that. Now, in my mind, the first step we thought about when all this happened is how to protect our staff and how to protect our patients. So if we decide to be open for a little bit of time in order to see post-ops, for example, which in my mind is much better to see your own post-op than the patient going to the ER, because that's going to overwhelm our healthcare system, which we don't want to.
Right.
Then
and
you have to have...
If you've had surgery recently, going to a hospital where there's cases, could you be more susceptible possibly?
Trust me, every time I go personally to a hospital now to do a surgery, I am extremely careful, to the point that when we finish the surgery, we change every scrub we have. When we go back to your house, you have to pretty much take most of your clothes in the garage and then spray your shoes and make sure you take a shower before you touch anyone. So you really have to go the extra mile to be protective for people around you.
Absolutely. And so, like as you were saying.
So basically for the office part, here's what we thought to do. So if we're going to be open, and some of the practices are open to see post-ops or urgent consults, then first of all, no waiting area. No one is sitting in the lobby anymore. Everyone comes with an appointment. They stay in the car until we call them to come in. When they come in, we let them use sanitizers, our own, to wash their hands. We give them a mask to put on while they're in the office. And obviously, all our providers and staff, they have masks in place. And they come in, they do their follow-ups, and then when they leave between patients, we make sure we wipe all surfaces, everything would touch with anyone. Gloves are very tricky. I think gloves are easy to use for healthcare professionals because we know what to do with gloves. It's a little bit harder for people who don't use gloves, because you can put the glove and think it's going to protect you. Well, it's not going to protect you if you touch your face. So you have to be careful about that. And your phone, and your watch, and everything. Right, absolutely, everything. Absolutely.
I mean, what you described is so thorough for leaving the hospital. I know that some of us are doing that just for leaving the grocery store.
We do that too.
We're all learning from doctors, from nurses, the different tips that you're giving. What are some of the surgeries or the procedures that people might think are elective, but really are not necessarily elective, that still really need to be carried out, or a patient needs to be seen for, that they'd come to a plastic surgeon for?
So every hospital and office basically had their own ways of looking at cases. And we were all sent this information. And in terms of if you're doing a breast augmentation of a liposuction, obviously that's not the right time to do it. But if you're doing some skin cancers, and these skin cancers need to be done, for example, malignant melanomas, these are cases that are better done quickly. Some of the basal cells, some of the squamous cells, not all of them, obviously, they might need sooner surgery than later. In our case, breast cancer reconstruction is the one that we do, and that's usually a consensus between different doctors, medical oncologists, surgeons, plastic surgeons, and so forth.
I would agree. I mean, my heart goes out to people who need to see a doctor for other reasons right now, or aren't feeling well, or have a case like that with breast reconstruction or surgery of that nature. And it's just very scary. It's a very scary time. We're joking that people with young children are always like, don't jump around because I can't take you to the urgent care right now.
That's what I tell my kids.
It's not an option. So for your peers in the space who aren't offering perhaps like a reconstructive or type of surgery that could be done, what have you seen your peers do to provide relief right now with what's going on in COVID-19, and what do you recommend for your peers to do if they wanted to help out?
So this is what we've done. First of all, telemedicine been a great thing for us. So we offer telemedicine for both our cosmetics and reconstructive. And I don't think there's anything wrong of doing a cosmetic consult on telemedicine now for anyone who requests it. You're not going to do the surgery now, but at least you have that, in the pipeline. So that's number one that works for us. Now, in terms of support for us, so first of all, you have to think about your small group, and your small groups are your staff and patient. We did something for our staff. We said we're going to support everyone for 1 month for the shutdown to start with, and completely no deductions, nothing. Everyone gets supported for 1 month. And then after the 1 month, we're going to sit and discuss how can we do our job better? How can we support people the most? Obviously, there are government things that people should apply for and so forth. Mm-hmm. Now, in terms of us as doctors and practices helping, there are many venues. Every society has a system. So the American Society of Plastic Surgeons, they have a system where you can line up your equipment. We have a surgery center, so we have PPE equipments, we have ventilators in the form of anesthesia machine, obviously, and we signed up with them and we told them if there is any need to that, please let us know. We're happy to give you this to use until the crisis is gone. But the most efficient thing we felt is the local hospitals. So every local hospital, some of them reach out to us, some of them we reach to them, and we said, listen, this is what we have in place. If there is a surge in your county or in your city, then you have to understand where you're back up. We even put ourselves as backup in the ER if needed. I mean, obviously we're more in the aesthetic arena, but we still have the background of medicine and we can help if we get to that point. Where we are, things are fine. In California, we're in Orange County, there's no surge so far. Things are stable, so there was no need to do that. But I think other parts of the country might need it.
Absolutely. Well, that's great to hear that that the community is coming together for their resources, their manpower, and then also their ventilators and the different items that they have. Because thankfully, and knock on wood, we're not in as dire of a position as other places on the East Coast here in California. But it's nice that the community is coming together. So I have a question here, which is, what is your expectation, best guess as to when practices will be able to reopen in California and the rest of the country?
So this is the $1 million question. What are we going to do and when? So when is going to be dictated by our local officials and the government and the states and so forth. My understanding is New York City, Washington, and LA, they extended the shutdown until the 15th of May so far. Now, Orange County did not do that yet, but it might end up being the same thing. But that's not the main problem. The main problem is, how are we going to open? I mean, you're not going to just go back to the usual things we did in the past. Things has to be gradual. And I think the best thing is to develop policies and procedures, obviously following the CDC guidelines and local authorities and things like that. But in terms of, for me, for example, what we thought about if we're going to start opening is we're going to continue the social distancing. We're going to continue not having people wait in the lobby. We're going to continue to screen patients on the phone before they come, making sure that they have no symptoms. When I go in the hospital now, they ask me a set of questions before I enter, and they check my temperature. And if I have a fever, they would not let me go to the hospital. So I think that's a system we should do. The testing. Testing is another huge item that everyone is starting to talk about. And we actually
Right.
got our own tests in the office. And we were
Okay.
starting to test our staff and myself, but then we stopped before doing that. And the reason we stopped is not all the tests are validated. There are tests that are not clear at this point,
Okay.
although they are FDA approved. So there are two companies that have been FDA approved, but still every institution is doing their own validation of these tests. So we decided to hold on until we get a better understanding from our local authorities and the federal government on which test to use, because you do not want to have a test with a false positive or a false negative result, because then you're really stuck. If
Yeah.
you have an IgM positive, you're going to have to well, of course, you have to do the PCR, which is the virus testing, but then you have to quarantine that person. Imagine you're doing this and the test is not accurate. Then you
Yeah.
entered into a totally different problem. So we're
Yeah.
waiting to hear from that. I think it's going to be one of the things we need to use.
Yeah, I mean, I think it would be tremendous if some of our local, medical offices that are considered non-essential at this point are able to provide some help with the testing. There are lines in Los Angeles County, as I'm sure you've heard, of people lining up in their cars to get tested. Can take between 5 to 6 hours to get through that type of line. Have you seen any of those or experienced any of those? Any thoughts on that process?
So in Orange County, there are a couple of testing centers in the parking lot of hospitals, and these are tests for PCR, for the virus itself. So if you have symptoms, the recommendation is to go get tested for the virus, and if you're positive, then you have to isolate yourself. Obviously, if you're sick, you have to go to the hospital. The antibody testing are so far, my understanding is they're still distributed through certain medical suppliers. You can go and buy them yourself, actually.
Mm-hmm.
But the question in my mind is, before you do that, just make sure, one, you have the right test. Two, what are you going to do with the result? We have a board-certified internal medicine, anti-aging, Dr. Lasheen, is part of my practice, and we refer to her when we have something like that. But there's so many variability in the testing in terms of you could be IgM positive or IgG positive. You could be negative on one and positive on one. You
Mm-hmm.
have to have a clear understanding. What are you going to do with these results? It's a
Right.
responsibility.
And I hope people are being honest with them too and letting the people they've been around know about the results. And I think as a society, we've done a pretty good job in terms of not having too much stigma around it, which was kind of one of my original concerns. But you have actually another question here, which is, aside from aesthetic practices closing their doors, what do you think the biggest impact COVID has had on the industry? So this would be the aesthetic industry.
The fear was that we're going to go through an economic cycle. So if you think about it, what happened is really a medical problem. This is not
Mm-hmm.
an economic problem. This is not 2008. But the worry is that the slowing of the economy becomes an economic issue. Now, what happens in an economic problem in practices that do aesthetics? People will start not spending money. And if people
Mm-hmm.
don't spend their disposable income, then it becomes an economic problem. So
Right.
far from what I've seen for our patients, and I hope everyone is feeling the same, there is a big need. Actually, people call us and says, when can I do my surgery? When can I have my Botox? When can I have my fillers? So far, it seems like the need is there. I think there's tremendous support from our states and government and things like that in order to have, I mean, of course, the money, I understand, did not get to people yet, but it will.
Right.
And that making people feel comfortable. This is not, there is light at the end of the tunnel. I can tell you, I'm very hopeful. I think
Mm-hmm.
this will end. We will learn a lesson, and we will be better prepared. And of course, until we have a vaccine, we're not completely safe. But hopefully, they were saying yesterday that maybe they'll have a vaccine by the fall for healthcare professionals, for all of us. And then for the general public, it might be rolled out in the beginning of the year.
Interesting, interesting. I didn't hear that. I mean, obviously, it makes sense that, there's an order of operations with who gets tested. I have a theory as to why people are interested for the doors to open back up. I think the time that we've spent kind of a very reflective time for many of us. There are many people who are thinking to themselves, you know what, I'm going to do something for myself when this is over, and I'm going to take better care of myself or finally get that procedure or treatment that I've always wanted. And I think that's going through a lot of people's minds where it's like, what do I want to carry from this? and what do I want to leave behind. And so hopefully people are wise and also, you know, making decisions that things that they've wanted. So that's my little theory on that. I've certainly felt that way. I do have one more question for you, which is, would these test kits have a clear explanation of interpreting the results? So I know you touched on that already briefly, but I think what people are just nervous. You know, they want to know that they're going to get the right answers, and I think a lot of people have a closer relationship with their aesthetic doctor than their primary care doctor. It's a more natural, friendly relationship. You see that person for good things, you know, versus like just a regular primary care. So I would imagine a lot of patients are actually inclined to listening to their aesthetic doctor or nurse about their thoughts on the situation, because it's a natural, it's not a forced relationship, it's a chosen relationship with that doctor.
I totally agree. So for the relation, let me start with the relationship first. A lot of the discussions we have with our patients now is really how to take care of themselves. I mean, they come to us to look good, but
Right.
they also come to us, how can we protect ourselves, how can we increase our immune system, what kind of vitamins we take, and we like to give them this advice. I think this is a very strong part of our business and our practices that will continue to grow. The second part about the test is pretty simple. It's look like a pregnancy test. Basically, you prick yourself, a drop of blood, you put it there, there's a buffer solution, and then it either give you one line or two lines. So one line means you have IgM, which means you've been exposed. The other line is IgG, which means you have immunity. But the problem is not that. The problem is you have to be ready to interpretation of the test. It's like, okay, if I have one and not the other, what should I do? If I have both negative, and then should I repeat the test? And when should I repeat the test? So there's a little bit of information that needs to come, in my mind, as guidelines from something like the CDC, where we're gonna all do it the same way. So at the end, we know that the results we're getting are the results we have to follow, because decisions will be made based on these testing.
Right. Yeah, that's very interesting. Thank you for breaking down the mystery of the test, because I don't think many of us, we've seen them, but we're not really exactly sure how they work, you know, in total. So my last kind of question for you is what's your advice for us to stay healthy? I know that's a big aspect of your practice. You have you know, a colleague that works with you where you specifically go over just wellness in general. As you take precautions for yourself and for your team, what's your message to us patients to stay safe?
So first of all, what we did from the beginning is, for our families, for ourselves, and for our staff. First of all, you got to stay away from the infection, which means social distancing, sanitizers, masks, everyone that the government and CDC is talking about has to be done. Number two, for yourself, you got to give your immune system the best way to fight the disease. So you have to sleep well, you have to have good rest. And my good friend, Dr. Lasheen, would always tell me, take your vitamin C, 2 grams per day, take your zinc, 15 milligram per day, take your vitamin D, and especially the good ones, the one that drops that you put in the mouth. Make sure that all this is completely covered, because what you're doing is, at the end of the day, we're letting our immune system defend us. This is our first and last line of defense. There's nothing else at this point until there is a vaccine. So we have to have a responsibility for ourselves and our families, like almost like a small fighting unit. I do the same for my staff. I ask them, did you take your vitamins? Did you do that? If they don't have a mask, I give them extra. If they don't have sanitizer for their house, I give them enough to carry at home. Because remember, if you got infected in your car, you're going to still bring it to wherever you're going to go. So it's a continuous process, and you have to be very diligent about it.
Right. And I think that we need to have a larger discussion with the public about what diligence looks like. And just a reminder to take all those vitamins that you took, because I'm guilty myself of not doing that. Now I have to go look for some vitamin D drops.
I'll let Dr. Lasheen call you.
Okay, great. And then before we wrap up, I think this is something that I'd like to ask my guests, which is, this is a trying time for all of us. So we're going through, like we spoke about, emotions we have never felt before, and thinking about things we've never had to contemplate before in life and in business and in health. What's the one thing that you want to keep with you when you come out of this? What's the lesson that you want to carry on?
The lesson is when you feel vulnerable and you feel in danger, and I have to say this, your life can end one day, and all of us, it will end one day. Then you appreciate the gift of life, as we say. The next morning when you get up, what are you going to do? What's really most important for you? And I think if there's one good thing came out from this COVID-19, it would be that we all got closer to our families and our kids and our significant others, and we managed to spend more time with them than we ever done in our life, probably. And it's a good thing, and it's really good. And, you know, so I think that there are some great lessons that we learn from this, and I hope as we go.
I love that. That was wonderful. Thank you so much.
Thank you.
Everyone, you can please follow Dr. Seify at newportplastic.com, at Newport Plastic on Instagram and newportplastic.com. And, you know, we hope to bring you back as another guest to talk about some other ways that the aesthetic community is reaching out, and the other tips that you have. And thank you so much for joining us.
Thank you very much. Wonderful, wonderful. And hopefully we can all stay safe.
Yes,
You take care. Have a great day.
Bye-bye.